First of all, I didn't expect to be an optometrist. Um, I was pre-med in college and came home one day and told my mom that I was quitting and wanted to go to art school. At the same time as, we were opening, we got sued by the private equity people for breach of implied verbal non-compete. I also thought it was something people paid for, so I ignored the first 10 phone calls that paid the called to let me know. And then I started having colleagues call to congratulate me, and I was like, what? This is some kind of nonsense.
This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. Today's guest is someone I'm thrilled to have on the show. She's a specialist in custom contact lenses, children's vision, and a leader in advancing optometric care and education. She's a past president of New York State Optometric Association and has served in national and local leadership roles with the American Optometric Association, the Optometric Society of the City of New York, and Women of Optometry. She was named #1 optometrist in the nation on America's Best Eye Doctors list in 2022 and has practiced on Manhattan's Upper West Side for over 30 years. She's founder of Acuity NYC. Please welcome Dr. Viola Kanevsky. Viola, welcome.
So nice to meet you.
Yeah, you too. I'm excited about this conversation. So what was the most important thing that helped you grow your empire?
So I'm going to have to say, a positive attitude, but also family. My mom, who is an incredible role model for me, and will be turning 80 this year and is still working, really has gone through so many hardships in her life and a difficult immigration, and has always supported me, and both financially and emotionally through my journey in building a career and building a practice. And my husband, who has also been just very positive, and no matter what crazy idea I come up with, he always says, sure, yes, dear. And that's how we roll.
That's funny. That's how I stay married too. So I like it. And so, you've been in practice for a long time, really long, lot of longevity. With that, I'm curious, you got the title of Best Optometrist in 2022. How did that come about? Just curious.
Good question. I think there was some kind of voting mishap. I think that site, just so you know, I wasn't always in my own practice. I'll tell you a little bit more about my journey, but I believe that's a survey that's done that asks both ophthalmologists, optometrists, as well as patients to rank a doctor that they would trust or refer to, and somehow that happened. I have a feeling a lot of it has to do with the fact that I post prolifically on various Facebook groups, and you know how it is. You vote for a name that you recognize. 90%.
Well, I wouldn't sell yourself short. I think you are an expert in the field. So I think it was interesting because I think we had this conversation in the prep call. I thought it was something that people paid for, but it turns out no, is like something that someone nominated you. Yeah.
I also thought it was something people paid for, so I ignored the first 10 phone calls that paid the call to let me know. And then I started having colleagues call to congratulate me, and I was like, what? This is some kind of nonsense. So I kept deleting it and reporting junk, when they text you and email you. And then turns out that finally they got through to me, and I said, I'm not paying for any of this. And they said, no, this is not a paid thing. I was like, oh, okay.
Yeah. Well, that's pretty high praise. And so as you went through your journey in honing your craft, in the journey as an optometrist, what was something that came up that was difficult as you were growing that you didn't expect?
Well, first of all, I didn't expect to be an optometrist. I was pre-med in college and came home one day and told my mom that I was quitting and wanted to go to art school. And she promptly grabbed me by the collar and marched me right back and said, no daughter of mine is going to be dependent on any man. So you need to go into a career where you will always be assured of a job, no matter what country you're in or what the situation is. And I said, okay, but at the time, we were immigrants. We were no longer immigrants, but we had immigrated to the United States. And I was frankly out of money and did not want to go into debt for school. So I kind of looked around. I had gone with my dad to his eye exam, and his optometrist went on and on about how much he loved his life. I didn't actually know what an optometrist was, but he went on about how much he had loved his career and loved coming to work every day and that I should really look into it. So I kind of did. My grandmother on my father's side was a pediatrician in the Soviet Union, and I knew I kind of always wanted to do something with pediatrics. And I looked into it and I said, oh, it's only 4 years and, possible residency. And I was a New York State resident. There was a state school. So I kind of looked at that and said, all right, I'll apply there. I can afford that tuition. And that's where I wound up being.
Oh, it's exciting. It's funny. It's like a happy circumstance. So
Yeah. And also I kind of liked it because it was the only one of the professions. At that time, there was no retinal photography. And I really like to draw. So I
nice.
still have that colored pencils that I used to draw retinas with.
Oh, wow. That's that's old school for sure. So
Right.
you could probably still retinoscope someone and get a refraction. So
I use that retinoscope every day. And if you're in
yeah,
pediatrics, can't do it any other way.
that's pretty interesting. I'm always amazed by folks that can do that. I'm not an optometrist, my wife is, and so it's kind of a cool skill. People just pop it out and be like, "Oh yeah, your XYZ prescription probably." So it's kind of
Right.
cool. Uh, so what made you want to start your own practice and grow your business and really hone your craft with your own practice versus staying in, with someone else?
So when I first graduated, like many students today, I had to pay back loans, and try to figure out what I wanted to do. So I worked at probably like 4 different jobs that year, in a couple of private practices, in a couple of opticals, in an ophthalmology office, and just to figure out what I wanted to do, but also to learn from other people's mistakes and just to see how other people ran their business. Because as you probably know, we were clinically very well trained in optometry school, but the business end of it is completely neglected. There's no practice management to speak of. So it turned out that within that year, I realized right away that one of the locations where I was working, which happened to be a retail storefront optical, was both conveniently located to where I live and allowed me independence, meaning I immediately spoke to the owner of that optical and said, I don't want a salary. I will just take my patient fees, and after a certain amount each day, I'll pay you back. We'll split it in half, and that'll be kind of rent. And that was a very unusual arrangement at that time. And he kind of shrugged his shoulders and probably thought that I was an idiot for doing that and said, great, I don't have to pay you a salary. That's great. And that's what we did for 14 years. It was quite successful. At that point, it had then been, I think, like he had expanded to about 7 locations. I was managing some of the other optometrists in the chain, and he sold to what is now called private equity, but at that time was venture capital. And they were actually from Canada. I think the last business they had bought were a bunch of beer breweries. And so they decided to go into the optical field and immediately came in and started telling me I wasn't seeing enough patients per hour. I was focusing too heavily in pediatrics, all sorts of things that I didn't like. And I left with one of the opticians, and we opened our own little tiny location. Also retail storefront, because that's all I knew at the time. That's what I knew how to build. And a year after we opened that, we had a sign at the door that said closed, getting married. And that we were at that location for 10 years until our lease ran out, and then bought a space on Central Park West across the street from Tavern on the Green, which makes for great after dinner drinks. And that's where we are today.
Yeah, that's pretty cool story. What was it? when you went to practice ownership, what are some of the things that came out that surprised you that you didn't expect as you started growing your own individual practice and spending time in your practice?
Well, the opening was absolutely terrifying because at the same time as, we were opening, we got sued by the private equity people for breach of implied verbal non-compete, which,
Oh, wow.
which
Okay.
got thrown out. And, although it cost us some legal fees, the judge's decision was that I actually could not leave my records with them because that would be abandonment of patients. So they had to shut down all like 3 locations where I had worked, separate the charts, and give me all my charts. And if I wanted to leave copies for them, which I did because I didn't want my patients to go have to have to look for their charts, they had to pay for those. So it actually worked out to my benefit that they sued me. But as you can imagine, it was quite nerve-wracking. I certainly didn't expect that. At the same time as we had kind of signed, a very expensive Manhattan lease. And we're flying by the seat of our pants. We kind of really didn't have a lot of idea of what we were doing, how were we going to do it, where were we going to get the money for it. So we hired some friends who are artists to build out the space virtually overnight. We kind of worked by night.
Oh, wow.
We opened, I think we got, if I remember correctly, maybe a 3-month build out, no rent. And we opened in 1 month, less than a month, really. And that first day that we opened was probably the biggest day we had money-wise to this day, because a lot of my patients came in and everyone bought something just to support us. They were so happy that, that I was going into my own business. And we finished that day. Our furniture hadn't come in yet. We had like barely any equipment. It was just literally the 2 of us. The phones were ringing off the hook. I was seeing patients while helping patients in the front and taking phone calls. It was nuts. And we kind of closed the door on that one day and said, I guess we're going to be okay. We had made the rent for the entire month, which
Oh, that's good.
not a small amount of money from Manhattan.
Yeah, I can imagine. It's that's a pretty cool story. I think that must have been scary going in like that.
Oh, it's absolutely terrifying. And then, of course, a few years after that, there was a big market crash in New York, if you remember. I forget what year it was, 80-something.
Which one, right? It's
90-something, I guess.
now it was a .com bubble.
2008,
Then, right?
2008, I
Or
think.
2008, the housing crisis bubble. Yeah.
Yes. So that was that huge crash. We were terrified that business will go down, how we pay the rent, because the rent does not decrease. No one stops the rent in New York. We were okay. We survived that one. And of course, New York and our patient base is very heavily dependent on the stock market. The way the stock market goes is the way the business goes. People are doing well in the stock market. Businesses do well. And if it's not, we don't. And then, of course, the next scariest thing was the pandemic, which happened shortly after we opened the new practice. But happily, my staff, as we added staff to the practice, I've actually never had to fire anyone, and I'm still working with, so we now have 3 opticians, 1 optometrist, and I've worked with these people. They're almost like my family at this point. Never really had to fire anyone, which is lovely.
Wow.
So we survived the pandemic. I did not lay anyone off. I didn't furlough anyone. I continued to pay their salaries out of my savings at that time. And they were lovely and continued to work from home and call patients. And we kind of managed, when you're small, an advantage of that is that you could pivot very rapidly.
Yeah.
So we spent that time when everything was shut down, calling our patients, doing things like I gave my staff a list of all of our patients who were over the age of 70. And
The high risk.
sat there and called all of them and make sure they were okay. And some would say, oh, do you know where to get Lysol? And we'd say, sure, we'll get you some Lysol. Non-optometry related things, but
Wow.
it was nice. And then we called all of the urgent carers in our area and said, hey, we can walk to work. And if you have emergencies, I can see them because I can go into my office by myself and just see patients one-on-one. And that was an enormous source of referrals for us. And they continue to refer after that.
That is incredible. I think you're very humble because like with some of the things you're describing are really, really hard things to do in business. So You basically had a crash course in build out and rushing to try to get a business while trying to, people are trying to sue you. And then on top of that, you had like a couple of crashes. But the COVID one is brilliant. Calling the urgent care centers and saying like we can be a referral source. And that was really cool how I like how you reached out to the patient. That's a level of care in the community that you don't see very often.
You know, like the optometrist that I went to with my dad. I do have to say, I really have loved my work. You know, people say like, if you love your work, it's not really work.
Yeah.
It is work. That's a lie. And I can't say that like every single day is fantastic. Of course, there are patients that drive us all crazy once in a while. But for the most part, I do love my patients. They've been very supportive over the years. And it's pleasant to, right? We're in this field because we like to care for people. And I find that pleasant and fulfilling and make me happy at the end of the day, right? So it made us feel good. It made us feel like we could do something during the pandemic. Otherwise, you sit there and you feel helpless. And of course, if you remember, no one knew what the heck was going on, how
Yeah.
the virus was passed, if we're all going to die tomorrow. So if we're all going to die tomorrow, I figured, well, at least let's go down together and, feeling good about each other and feeling good about the community. And it was nice because a lot of people just had questions. They looked to us as medical professionals and no one else was giving them information. And it was nice to have that community.
Yeah. And I'm getting this thread, a constant thread across your stories and is care. You care about your patients, you care about the community, you care about the business, you care about your staff. I do want to touch on that. You really you haven't really lost employee. Like, tell me more about that because that's people are
One
struggling with that.
employee,
Yeah. One
in
okay.
35 years, but she fired herself.
Okay. But you've had employees for a very long time. It sounds
Yeah,
like.
and even like one of my techs is the one. I mean, she's still around. She is a daughter of one of my opticians, so
Oh
she
wow.
worked for us for many years. I thought she'd go to optometry school, and she left actually to open her own practice. But we're still in touch, and you know, she comes with Philton when we need her. But I've never really had to really fire anyone. My staff is lovely, and they also care about the patients, and they also enjoy coming to work. So I mean, there are times when, like during the pandemic, they were calling and begging to come into work. I'm like, no, stay home. I don't know how this virus passes yet. Like, I'll let you know when I need you. But they're like that. They'll fill in for me when I'm sick.
Yeah.
It's
That's incredible. How do you foster that culture? So if someone's listening to this and say, I want to be able to do that, with my staff, how do you kind of tell us your secret sauce?
when you work in a small space, you have to be, I think, cognizant of people's needs
Mm.
and really treat them like you would treat your family, or perhaps better than you would treat your family. We don't fight it much.
It
Uh,
depends on your family, right?
Everyone is
Yeah.
cross-trained,
Okay.
which has not only the benefit of if someone's out sick, anyone can cover, but also everyone knows how hard the other person's job is, right? So they all respect each other's jobs. There's not, and if I walk into the bathroom and I see that it's dirty, I will absolutely pick up that toilet brush and clean the toilet. No, I'm not like the doctor, and I don't do that. And they do the same, right? So it's nothing is beneath anyone. Um, Everyone does everything. Um, so I think that makes for mutual respect. I've always tried to have all of the staff, because they have families and I respect that I want them to have family time. I always try to have no one work more than 4 days a week,
Mm.
adequate time to spend with their families. Um, they really treasure that, and I think appreciate that. I try as best as I can to offer health insurance for everyone and pay for it so that they're covered, which is important. We have an annual staff retreat, which everyone loved.
Mhm.
There's a resort about an hour and 45 minutes from the city called Mohawk House, which is my happy place. I love it there. So, like, we just had one this year. We go up with the staff. We all drive up together. I'll do some kind of training over breakfast. Then we all hike up the mountain. They repeat back to me what I taught them. We have lunch up there, come back down. Everyone has massages,
Nice.
hang out for a while and chat. Then we have an early dinner, and then my associate presents something. Then they repeat it back to her. And then we let my husband do his, we call it Doug's gripes and grumbles. He actually has a list of what is everyone upset about in the practice and how do we fix it. And and then we come back together, and it's like a really nice, relaxing thing. We close the practice for the day. It's only once a year, but I find that when you try to train your staff or have meetings during patient time, it's virtually impossible because the phones ring. I think as much as I've tried to do that, and I think it's important,
Yeah.
it's very hard to do in a small practice. And so
Yeah.
you wind up neglecting that. And so just setting aside specific time to do that with your staff, even if it's just once a year, is really, really important to build that team.
Yeah, I like that. Tell me a little bit more about that exercise your husband does. So what I heard was that you give him a space to talk about what they want to change and, like you said, gripe or I don't want to put words in your mouth. Tell me about that.
Yeah, before each one of these retreats, about 2 weeks before, I ask all the staff to write down what they think their strengths and weaknesses are. Actually, I asked them to write down what their weaknesses are, and then everyone has to write down what everyone else's strengths are. And then if anyone has any, we call it gripes and grumbles. If anyone has any pet peeves about whatever in the office, like leaving your dirty cups in the sink or, really anything that bothers anyone, I ask them to write that down, and then we kind of present it at the retreat. We call it Doug's gripes and Doug's gripes and grumbles. It's a mouthful. And actually this year he said he had none, so we skipped it. But it's, generally it's little things, but kind of like in a marriage where, throwing your dirty socks on the floor or leaving the toilet seat up eventually drives couples crazy. In a small practice, I think little things drive people crazy, and it's important to acknowledge them and try to fix them before they become this really major annoyance, right?
Yeah, I like that. That gives us space for that. It's almost like it's interesting because a lot of this sounds like a function of just being so close together because it's small spaces.
Also, I think having your employees and yourself list your own weaknesses and point out other people's strengths, I think makes it safe and people are pretty good at pointing out, at knowing what their own weaknesses are. And if you ask them to do that, they will try to correct them. Where do it the other way becomes almost accusatory, right? If I say, well, I think you need to improve this and you need to improve that, then it becomes a directive for me. I kind of used to do that with my kids, right? When they were little. Instead of my telling them, okay, it's time for you to go practice, instead we had a schedule on the wall that said, okay, 3 o'clock, you have to do this, and 4 o'clock, you have to do your homework or whatever it is. And we go to the refrigerator and say, oh, what does the refrigerator say? It's time for this and this now. And they'd help write the schedule themselves. So it was never mom yelling at them to tell them what to do so that they could say, no, I don't want to do that, right? It was more, they wrote the schedule, they had control over it, so now they're going to go and do it. So, and I know why I'm not to say that my staff are children or behave like children, but I think it gives them ownership of their own faults and method to correct it. And also, I think ownership in the practice.
Yeah, I like that. So tell me a little bit about what you're excited about in the future of the profession, of your practice. What are you looking forward to in the let's say, next 30 years of optometry and as you do in your second half of your career?
Oh gosh. Well, lumps, bumps, and lasers are on the agenda as we fight to expand our scope. My own career has changed so much in the 30 plus years I've been practicing. I was the first class to be grandfathered into topical medications in New York. And then, of course, we got glaucoma. Now we have oral. And, because we're a legislative profession, we've been fighting for that. And I've certainly been going to Albany every year for 30 some years. And then Washington, D.C. to lobby for that. So to protect our scope and to expand our scope has been both challenging, but also exciting. And it also means that I can stay at the very cutting edge of my profession, all my professional life. You can probably call it functional ADD. I get easily bored with any one thing. So I'm always trying to add new things to the practice. I'm always an early adopter. I love technology. I love toys. So I'm always excited to see what the next thing will be. I'm certainly very excited to begin negotiations for a buy-in from my younger associate. She's been with us for 3 years now, and we've just entered those negotiations. So I look forward to having her as a partner. And of course, one day I look forward to retiring too.
One day. Well, it's kind of cool. I like the fact that, you do a lot of, publish a lot. So it sounds like you have a lot of, ways that you've kind of shared your knowledge and insights. So it'd be kind of cool just selfishly. The what you do around the culture seems really interesting and different. So, with your patients, with your community, with your staff, all of that seems to be a unique perspective. So I appreciate you sharing that.
Yeah, it's really loved it. It's been fun.
Yeah, excellent. Let's shift gears a little bit. You've kind of told me a couple, but I'd like to hear what you feel was a story that was very formative for you. Maybe another one that you haven't shared yet, something that made you who you are. And it could have been, like I said, it could have been when you were a younger kid, or it could have been more recent.
When I was about, I want to say 3 years old, my grandfather brought me this really beautiful doll from Germany that had eyes that open and close. And I remember being desperate to figure out how they worked. So, sadly, this doll had both eyes excavated out of her head, shortly with a screwdriver. My mother was horrified at this.
She's like, "Oh my goodness, I have a psychopath as a child." Yeah, yeah.
I was a psychopath as a child.
No, oh no, I'm not seriously. Oh, that's
Formative years as a young budding optometrist.
that it was in your future, right? Already studying about eyes. That's cool. Um, it's a very curious kid to do that.
Oh, I did a lot of crazy stuff. We were also, I think, the first ones in our block to have a TV
Okay.
in the Soviet Union. And there was, in the Soviet Union, there were like maybe 3 TV shows, right? In the evening, there was news. In the morning, there was some program for the elderly. And in the afternoon, there was a little children's program. And there were these, I think if I remember correctly, a little puppet show or something that went on. And of course, I took the TV apart as well because I wanted to get the little men out of the television, free them.
That's cool. So you've always been almost like an engineer at heart.
Yeah, my mom was not very happy with that either.
Yeah, well, that was a little more expensive. Yeah, that's especially back then when TVs were a little more scarce, and the big ones with the cathode ray tubes, and yeah.
Yeah, but I think, more seriously, the fact that we traveled so much as immigrants as a child was very formative for me. I learned to both be resilient and just not afraid of change because we went, starting from age 4, till I was 12, right until we got to New York. I changed schools almost every year. And so I had to learn a new language, be the new kid in class. Every year was something different, new town, new school, new place to live. Often I had to translate for my parents because, of course, as a child, I learned the language faster than they would. So if they went to a store, I would have to translate for them and so forth. So you kind of learn to navigate the world and not be afraid of change. I was actually a very, very shy child. And I remember hiding behind my mother, like going to the bus, and she would pull me out and make me say hello to the bus driver. And I'd like whisper, no louder, he has to hear you. Right. So you learn, right? It's not I wouldn't say that your personality changes, but you can learn to overcome shyness, right? I remember one of the most difficult things I've ever had to do as an optometry student, was that first day that you come out and take your first patient in to your exam room. It's like, think about it. It's terrifying. You have to walk out, shake hands with a complete stranger.
Yeah.
And take them into a room and talk to them when in fact you're shy and don't really know what you're doing. And you have to do that 16 times a day the rest of your life. So you really have to learn how to speak up and say hello and smile. Doesn't matter how you feel. Doesn't matter what happened at home that day or what's going on in the news. You have to be there and present for that patient and put on a happy face. And so I think all that immigration and traveling that happened really helped me to do that.
Nice. That's pretty, I love those stories. Thank you for sharing those. And let's say, knowing what you know now, what advice or experience share would you give your younger self about a week out of optometry school?
Oh, my only regret is I wish I have a classmate whom I very much respect, who also does pediatrics, and we lecture together and we do a lot of stuff together. We go to conferences together. We've served on boards together. But I really wish that instead of waiting 14 years to open my own practice, we had just from day one started cold together with nothing, because easiest way to have a partner before anyone has anything, right? There's nothing to divide, kind of like a marriage when you start with nothing. And I think we would have been quite successful and 4 times as big, right? He works in a large pediatric ophthalmology practice. I have my own practice, but we could have easily done that. Of course, at this point, our careers are a little bit late, but I do wish we had done that. And I often will tell younger students when I mentor them that don't be afraid. If private practice is something that you want, go for it. Find that friend in school that you respect and you think is smart and wants the same thing, and just go for it. The money will come.
I love that. That's great insight. It's funny. We hear that a lot in the podcast. From folks who didn't open up right away or really close to the beginning. They're like, yeah, I wish I would have done it sooner, or taking more chances. Or it seems to be a common thread.
Our profession, if you think about it, why does venture capital try to buy optometry practices so frequently?
Medical in general, right? Yeah.
Well, yeah. What's your options, right? You have money, you want to invest. You can put it in the stock market, and if you're conservative, you'll make 5%. If you're very aggressive, you'll make 8%. Or you buy treasury bonds, right? Which who knows what happens with those. But if you buy a medical practice, that's a basic wish, given return and easily at least 10% on your money. Yeah. So they don't go out of business. They're pretty safe. So why should, banks will loan you money. So just do it. You'll make the money back.
Yeah. Yeah. And it's a lot easier to get loans for doctors than it is non-doctors, for sure.
Yep.
Oh, cool. Well, Viola, where can people find you if they want to reach out to you?
You are welcome to email me, viola@acuitynyc.com. You're welcome to come visit me. Just give me a heads up on my practice on the Upper West Side. Again, right across the street from Tavern on the Green. If you are in New York and want to go to a great conference, I will be at Innovation Vision Conference in Syracuse shortly. I'm always at the AOA conferences. If there's a meeting somewhere, I'm likely to be there.
Likely speaking. Excellent. Well, Dr. Viola Kanevsky, thank you so much for being on the podcast.
My pleasure. Thank you so much for giving me a call.
Yeah, and a couple of my takeaways from this, I really learned a lot. I love the gripes and grumbles. I love you take care to a whole nother level. When you told me that story about, hey, what do you need? You need Lysol wipes? Great, we'll get that for you. Even though we have that's not really what we do, but we'll do that anyways for you as a patient. And I love the ownership piece of it. Everyone takes ownership when they feel like they have a piece of responsibility. So thank you for sharing some of those lessons with the audience.
My pleasure.
And thank you, audience. And if you learned something or laughed, share this podcast with a friend, and make sure you hit the subscribe button, and so you never miss an episode. And if you use the HubSpot link in the show meeting notes, I'll send you a free copy of my book, Optometry Redefined. Thank you again, Viola, for being on the show. This has been another exciting episode of Optometrists Building Empires, and we'll see you next time. That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.